Hello and namaste. Welcome everyone to e-Samvaad 2020, a two-day National Youth Conference organized by the Model Governance Foundation under the aegis of Alexis Group. It's the third edition that we are organizing, but the first online edition for Samvaad. We wish to engage young people in meaningful discussions and conversations aimed at making India an inclusively developed country. There are various events that are being organized under the event. There is paper presentations, workshops, guest presentations, group discussions, and interactive lectures like this. Samvaad is a platform where distinguished luminaries from the fields of politics, business, academia, entertainment, journalism, and sports come together and share the stage with leaders of tomorrow, that is you, and engage in dialogue while motivating you to reach out to the paramount potential in pursuit of solutions to the challenges that we see today's world. It aims to foster leadership qualities among students and young professionals by opening a cross-cultural dialogue on issues of national and international relevance. Let me also take this opportunity to tell you a little bit about the organizers. Model Governance Foundation is a non-partisan, non-profit, and non-political organization working for good governance, smart governance, national integration, and communal harmony. Its key areas of intervention are administrative reforms, legal awareness, public policy, and women empowerment. Alexis Group, under the aegis of whom this event is being organized, is India's leading federation of youth organizations, bound by the common motto of passion for excellence. Our diversified interest sectors include business and startup advisory, communications, consultancy, education, entertainment, healthcare, publications, service, and welfare. There are 6 member organizations, namely Alexis Society, Alexis Foundation, Model Governance Foundation, Adrit Foundation, Agrasar Foundation, and Advik Foundation. To know more about our work at Alexis, you can visit us at alexis.in. And for Samvaad sessions, you can join us at samvaad.co. Now let me introduce the guest for today's session. For this particular session, we have a distinguished guest with us. Let me introduce Professor K. Srinath Reddy, the President of Public Health Foundation of India and formerly head of the Department of Cardiology at the All India Institute of Medical Sciences. He was appointed the first Bernard Lown Visiting Professor of Cardiovascular Health at the Harvard School of Public Health from 2019 to 2013. And presently, he serves as an Adjunct Professor of Epidemiology at Harvard. He holds advisory positions in several national and international bodies and recently published a book, Make Health in India, Reaching a Billion Plus. He is also an Adjunct Professor of the Rollins School of Public Health, Emory University, and Honorary Professor of Medicine at the University of Sydney. He is the first Indian to be elected to the National Academy of Medicine, United States of America. He was awarded several prestigious international and national doctorates and fellowships. He is also a Padma Bhushan awardee. Under his leadership, Public Health Foundation of India has established 5 Indian institutes of public health in different regions of India to advance multi-disciplinary public health education, research, health technologies, and implementation support for strengthening health systems. Professor Reddy is a member of the Government of India Technical Task Force for COVID-19. He is also an advisor to various state governments, including the governments of Odisha, Punjab, and Andhra Pradesh on public health. A very warm welcome to you, Professor Reddy, for joining us for this session of Samvaad. I welcome. It's an honor and privilege for us to have you with us here.
I'm happy to be here with you.
Great. Thank you so much, sir. And since, let me, without much further ado, let me just begin with the first question that I have. Our audience is, mostly young students and young professionals across the country. And one of the things when we think about health comes to our mind is that it's slightly private and personal for all of us. Like it's mostly relates to friends and family and sometimes not beyond it. So in the context of that, what I would like to know from you as the first question is what is public health and why is it so important for India?
Well, while we are really preoccupied with individual health, whether of ourselves or our family members, we have to recognize that health is determined by many factors which operate at the population level, at the wider society level, or even at the limited community level where we reside in. And these factors have a profound influence on our health across the life course. So while it is easy to think of water and sanitation and air pollution as important elements that determine our health, how food and agriculture systems determine our health, how our access to education determines our health, how our financial status, or whether we are poor and cannot afford either health literacy or health care, all of these have a profound impact on health. So public health actually deals with all the determinants of health at the population level, which ultimately influence and impact upon health at the individual level. So we are dealing with some of the policy level issues, whether it is tobacco taxes or making healthier foods less expensive to consume, or whether we are dealing with even things like whether it is necessary to wear safety helmets when you're driving a motorcycle. All of these are public health issues ultimately, and they impact upon the health of the individual. Secondly, system level issues. While you may say, okay, I'm going to a doctor or a nurse, and this is purely a personal health issue where it's a matter of consultation. But whether there are enough number of trained doctors and nurses available, what is their skill level, what is their motivational level, are the necessary equipment available, are the drugs in short supply, all of these are again system level issues. Again, when you leave the doctor's office, do you have the drugs which are affordable and easily available? Or are you able to get nutritious foods that are necessary to help you recuperate? Are there systems for effective rehabilitation or palliation? Again, as I said, these are system level issues. So we are dealing in public health with a broad set of determinants which ultimately impact upon individual health. And to put it more simply, public health actually delivers at the wholesale level, whereas clinical medicine delivers health at the retail level.
Thank you so much, sir. What is the Public Health Foundation of India doing in this space, and how young people like us can get involved and contribute to the self-reliant India in the healthcare sector?
Well, Public Health Foundation of India was essentially established in order to build this broadband capacity in public health, which is truly multidisciplinary, which is capable of influencing health, certainly through the health sector and the health system, but also can influence the determinants of health through other sectors as well. So indeed, a person working in financing and looking at health financing is a public health person if they understand health economics. A person looking at how urban development has to take place with safe passageways for traffic flow, but at the same time reduce pollution levels and facilities for people to navigate and exercise safely, safe pedestrian pathways, cycling lanes, and so on. They are also promoting public health in several ways. So our idea was to essentially build in that multidisciplinary mix and make it available for influencing health in all of its determinants through multiple sectors. So we established 5 institutes of public health in different regions of India with one more ancillary center. We have institutes in Gandhinagar, Hyderabad, Delhi, Bhubaneswar, and Shillong, and an ancillary campus in Bangalore, where we are training a large number of people. Again, we are drawing in people who are graduates in multiple disciplines, but imparting masters in public health, PhDs, and also a variety of diploma programs. So we are training both public health professionals, who are teachers and researchers, but also public health practitioners who are actually changing the way health system can actually be transformed. And we do provide technical support also to governments as well as non-governmental actors as and when we are requested.
Thank you, sir. So, since we are on the topic of public health, a very small percentage of Indian health ecosystem is actually funded publicly. So, and the largest sector is sort of privatized in nature. So, what is your opinion on that? Do you think we need nationalization, or do you think we need to sort of empower more privatization in the segment. How do we deal with, sort of in the context of making India self-reliant? What is it that we need to do in this segment to make it happen?
Well, firstly, we have evolved a mixed health system by default and not by design. Originally, when we became independent, our emphasis was on a public sector provision of healthcare services. Unfortunately, over a long period, we have had very low resourcing of public sector. And therefore, we had severe shortages in terms of healthcare supply, but whatever was available was through the public sector. And you also had small private nursing homes, charitable hospitals, and so on, which provided a modicum of private sector services. But with economic liberalization and globalization, with a lot of investment flowing in, the private sector started expanding beyond the nursing homes into corporate hospitals. And now you're seeing a very large growth of the private sector, but still mostly urban concentrated. So you have disparities across rural and urban areas. But importantly, the public sector has actually dwindled in importance because of long years of neglect. No country has achieved universal health coverage and provided accessible and affordable care to all of its people without a strong public financing background. Therefore, our country has to raise its public financing level from the 1.2% of GDP, which has been stagnant from 0.9 to 1.2 over several decades, to a much higher level, closer to 3%, but at least to 2.5% over the next 5 years. So unless this happens, we are not going to see the public sector strengthened. And at the same time, we need to bring in the private sector because it's an entity that exists into the framework of health service delivery, but on clearly defined terms. So under the architecture of universal health coverage, the private sector has to be brought in as an extended arm of the public sector with clearly defined deliverables and accountability mechanisms. Then only we'll have a cohesive delivery system for a variety of health services across the country with efficiency as well as equity.
Great. Sir, a lot of comments say that private healthcare is not sustainable and affordable from the context that all the government schemes are targeted at only the lower strata of economic segment. And where do the middle class go when the medical expenditure is rising day by day, and insurance is still not very accepted norm in India? Like very few people have access to those kind of instruments. So considering that the expense is rising and the points that you mentioned,
Okay.
what is the solution? Like, can we have universal healthcare package for every Indian to make sort of one India, one healthcare package? Is that a possibility in any time soon?
It is very much needed. It can't be built overnight, but unless we start doing it, it's never going to happen. And it can happen soon because COVID actually brings to us very clearly the failures of our health system. If you do not have a health system that is functioning well in the steady state, as I said, with efficiency and equity, you cannot suddenly have a surge response in the face of a public health emergency. So you do need to have a public health system or a health system which is functioning very well even in the best of times, so that it can cope with the worst of times when the situation arises. But you ask me, where will the middle class go? Forget the middle class. Where did the Prime Minister of UK go when he had to be admitted for COVID-19? He went to an NHS hospital. So that is the kind of system we need to build in. And it is not impossible to do that if we actually spend the right kind of money and bring in the right kind of partnerships between the public sector and the private sector, which, as I said, cannot be wished away, but need to be brought in, but with a certain amount of discipline and commitment. So that is where we need to actually develop our healthcare system quickly. And for that, it is absolutely important that we prioritize primary healthcare, both in rural and urban areas. Because unless that is strengthened, most of the services that are required will not be available to people, because primary healthcare provides service to almost every individual in the society at some point in life or other across the life course. whether it is childbirth or palliative care, or in between, treating for diabetes or hypertension, or for whatever is the service required. But at the same time, it also ensures the widest bundle of services to be delivered with the most affordable cost. So it's the most cost optimizing element of universal health coverage. So you need a strong rural and urban primary health care on which you build advanced care with sufficient links and a bidirectional referral system where people who need advanced care go and come back for chronic continuous care or convalescent care back to the primary healthcare system. We can't have a health system in a disjointed manner functioning in bits and pieces and then expect either efficiency or equity.
That's great, sir. I think the cohesive ecosystem is the answer, as you say, and I guess a lot of young entrepreneurs who are listening to it would take that up as a challenge and sort of come up with an interesting sort of data stack or something, other technologies that might help us, build that ecosystem for India. So while you mentioned COVID, and COVID has sort of stressed out our medical ecosystem or healthcare ecosystem, and also it has also hit the reboot button at places. For example, a lot of quick policy decisions have been implemented. A lot of startups have been integrated into the ecosystem by providing sort of quick technology solutions, like all these IITs and other institutes have made low-cost ventilators. And then we have the personal protective equipment industry, which has certainly, obviously, has grown in India in the past few weeks and months. So, can we become a world leader in that segment, or do you think that these quick policy decisions will have some kind of repercussion, or maybe this could be actually a normal that we can sort of take forward and build into the ecosystem so that we innovate at the ground, we produce at the ground, and not only build for India but also build for world?
Yeah, basically our response has been good in terms of trying to become much more self-reliant. In fact, this is not something new that I've been saying. We have actually written in our high-level expert group report on universal health coverage in 2011 and submitted to the Planning Commission, saying that whether it is in terms of equipment or in terms of drug production, particularly the active pharmaceutical ingredients, we ought to have much greater self-sufficiency and even have greater investment in our public sector pharmaceutical firms for production of vaccines and essential drugs, even under compulsory licensing. But unfortunately, what has happened is the euphoria of globalization and the feeling that we can import anything from anywhere and we can export anywhere sort of prevailed. So the interdependency increased, which is not a bad thing if there is complete global and social solidarity and there is no emergency of the kind we are seeing. But that solidarity broke down the instant COVID-19 became a major problem. Everyone for himself or herself, everybody fighting for PPEs and testing kits and vaccines now being cornered. So all of these, we do not know what will be the access to vaccines which are developed in other parts of the world. So there is actually now a sudden realization that you need to be self-sufficient to a large extent. I believe that there is a need for universal solidarity, global solidarity, and of course, social solidarity within India, but it has to have a strong element of self-reliance, along with reaching out to others as per need. The Portuguese writer Miguel Targo said, universal is local without the walls. So you need local solutions, local self-reliance, but without barriers for exchange of knowledge and exchange of support as and when needed. But I think what COVID-19 has taught us is we do need to stand on our feet.
So on that note, sir, my next question would be that what is your blueprint for us to stand on feet and sort of take this crisis not as a missed opportunity, but actually, sort of come up with plans and things in place so that we can become really self-reliant in healthcare sector?
Well, first is the recognition that health is absolutely pivotal for not only individuals, but for economic stability of the society and economic growth of the society. This relationship has to be recognized, and even for social cohesion for that matter. Because for much of the 20th century, it was thought that health is going to be a passive beneficiary of economic development, that health benefits will inevitably accrue as per capita income rises, which is true. The Millennium Preston curve did show that up to a level, the life expectancy increases as per capita income increases, then it plateaus off. But it has also been very clearly shown that, firstly, there is a bidirectional relationship between health and economic development. The healthier the population, the better the economic development. And also, there is a bidirectional relationship between poverty and ill health. If you're ill, you are likely to become more poor. And if you're poor, you're more likely to become ill. So these bidirectional relationships have to be recognized. And equally importantly, it has been recognized that at any level of per capita GDP, the income inequalities within a society actually impact upon how much health benefit you derive. More equal societies will have much greater gains in life expectancy and other social indicators than unequal societies. Among OECD countries, the United States has among the lowest life expectancy, particularly compared to Japan and even others. So that shows an unequal society really doesn't reap the benefits of economic development fully. So as we pursue our own economic development, we must keep in mind, firstly, that health is important as a lever for accelerated economic growth. And secondly, we must try and reduce the income inequalities so that all of us can benefit. It's very clear that if the poor suffer, the rich also will suffer. Because you're seeing what's happening in COVID. People are running scared of people in slums. People are running scared of people who are migrants. No, these are what we call negative externalities. If somebody becomes unwell, the illness can be acquired by somebody else too. So you have to have social solidarity, and you have to have definitely accelerated economic growth, but with better redistribution. But recognize fundamentally that health is a critical, crucial investment for economic growth and social stability. And building on that, you then create a strong primary healthcare system, strengthen your district hospitals, strengthen your medical college hospitals, and of course, bring in private hospitals as per need, including private primary care physicians, build in networks which are horizontal at each level of care, and networks which actually integrate and link between primary, secondary, and tertiary care levels, and then run a system which is much more efficient rather than each individual being told you have to take care of yourself and run from pillar to post when there is an emergency.
Thank you, sir. I think you said it right, that social solidarity and equality is something that we need to sort of take up as a mandate, and we need to integrate health as a pillar for economic growth, and only then the success or the results that we are looking for will come. Since sir, I'm going to ask you sort of top of the mind question from the COVID sector, right? So a lot of misinformation, hysteria, sort of crisis and everything sort of going around. People have lots of questions in their minds. So, do you have any specific suggestions, like what should people do, what should they not do? Because everything is opening up, and then cases are increasing in different parts of the country, especially bigger cities. Do you have any advice for us?
Okay, let me give a few stats just to cheer you up and cheer up your listeners a bit. We are told every morning by the newspapers and the television about how the cases are mounting and deaths are mounting. It is true that we must treat them with serious concern and take action. But when you look at the absolute numbers, you must also correct them for the size of the population. For example, now you have in India 4,74,000 cases reported as of an hour ago, and you have 15,000 deaths reported as of an hour ago. But you take the population size, your numbers are 354 cases per million. Your deaths are 11.2 per million. Compare that with the United States, again, this morning. US has 7,462 cases per million as opposed to our 354. It has 377 million deaths per million as opposed to our 11.2. Now, the US has more deaths per million than we have cases per million. You may say we are undercounting, but even if we undercounted our deaths by 100%, still we are pretty low. But that sends a lesson, A, that we should not be despondent, B, that there is much to protect. There's a lot to protect. Many parts of India are not very much touched. Rural areas, smaller towns, they're not touched. A good deal of Eastern India, barring Calcutta, has not been touched that much. So we need to take all the precautions at the population level in terms of observing how best we can protect ourselves and others by appropriate physical distancing of at least 1.5 meters, but preferably 2 meters. Masks, very important, and hand washing is very important. Even where physical distancing is not always possible, masks and hand washing have been shown to reduce the risk by about 60%. So that's what we need to do. We need to create a bumpy road for the virus to travel so that it doesn't easily start traveling on a highway. And this means that we have to stay cautious for several months now. It has to become part of our behavioral pattern. And it is possible, if we do that, we not only slow down the transmission of the virus, but because of evolutionary biology, we may be able to nudge the virus to mutate to a less virulent form. Because when the virus doesn't have a new body to occupy and replicate its RNA in, for its own survival as species, it tends to become less virulent. That's why in the wildlife, it exists quite peacefully, coexists with the wild animals. It's only when we create a conveyor belt by introducing it into captive bred animals and human habitat, and it can travel very freely, hitchhiking along with human travelers, then it becomes more virulent. So we have to use it for our own protection and for broader societal protection. So don't be despondent. We have measures in which to combat it. A vaccine may take 1.5 years, we do not know. But till that time, we have to take all the protective measures that we can.
Thank you, sir, for sharing that advice and sort of clearing some doubts for all of us, and also to some extent, helping understand the stats, not just whatever is there out there. I mean, you explained it for us to sort of delve deeper into it and sort of take everything with a little bit of pinch of salt, I guess, and then learn accordingly. So, sir, in the healthcare sector, what are you noticing that pre-COVID, what were the problems, and during COVID, what kind of problems, are sort of created in the ecosystem, and also what is sort of going to become like the new normal in the next phase, the post-COVID phase? Do you think a lot of things that did not exist before the COVID has given an opportunity to build those ecosystems and they are going to stay, or should we build a new and more resilient system going forward so that we are better prepared for such future events?
Well, I think in the pre-COVID system, we had a lot of deficiencies quite evident in our health system. Whether it's a weak primary health care or district hospitals not being properly developed in large parts of India. The southern states did well, but many of the other states did not. So we had a lot of disparities. Even urban primary health care was not existent virtually. If the rural primary health care existed, it was weak, but urban primary health care was practically non-existent. So these are some of the deficiencies that existed then. And equity and affordability of healthcare was always a question mark in many places. But now with COVID-19, there is a greater sense of urgency to build up a stronger health system. But given the challenge of COVID-19, many of the other health services have been neglected, whether it is antenatal checkups for pregnant women, vaccination for children, newborns, or whether it is care of diabetes and hypertension, non-emergency services for most conditions are virtually given up, and even emergency services are limited for non-COVID patients. That again rams home the lesson that you cannot hobble on one leg all the time. You need a much more balanced health system which is capable of responding both to the routine requirements as well as to the emergency care requirements. Therefore, we have to have the determination to build a much sturdier health system as we move along. And we have an opportunity now to start investing in that and move along. I don't think we can have a health system which is back to business as before. We need to bring about radical reforms in the way our healthcare system is structured, better financing, but also better planning and prioritization. As one of the former directors of the All India Institute of Medical Sciences, Dr. Ramalingaswamy, used to say, we need more money for health, but also more health for the money. Therefore, you need more public investment in health, but at the same time, we also need better allocative and utilization efficiencies. That is where primary healthcare and district hospitals should get much greater priority. But certainly, we need to plan and strengthen our health system across India, not allow weak links to remain in any single state.
On that note, sir, I would like to ask you about capacity that we have in terms of medical personnel, doctors, nurses that we have. Like, COVID has sort of shown us that we are very much stressed out in that segment. And also, like many other countries, has the same problem. Even US has the same problem, and we also that. I have always wondered because my father wanted me to become a doctor, but unfortunately I did not become one. I instead became an entrepreneur. But uh, at that time, what I always wondered, is that why they have so many less number of seats to become doctors. Because for a large country like us, we need more and more doctors and more medical staffs, and that number really hasn't changed. Even though we have more AIIMS now, but not a lot much doctors have been produced according to the capacity of the country. So and you, as a creating the Public Health Foundation of India, you are trying to sort of build an ecosystem of training and sort of public health professionals in that domain. So I would like to know from you, sir, what has been your experience, because you have been a practitioner, now you are a policy influencer. So how does these things work, and how do we need, and sort of what should we do in this segment?
Well, absolutely right that we are very, very short in our health workforce, apart from other areas of our health system. If you look at medical doctors, we are 1:1,511, whereas the WHO standard is 1:1,000. If you look at nurses, we are 1:670, whereas the WHO standard is 1:300. In terms of beds, we have 0.77 beds per 1,000 persons, whereas the standard is 2.5 globally. But remember, these are aggregate indicators. These do not tell what's happening in different parts of the country. The South is much more blessed in terms of numbers and doctors and nurses. Whereas if you go to Bihar, Jharkhand, Chhattisgarh, or Northeast, it's a very different story. The numbers are even much more starkly deficient. So therefore, you have to plan state by state and almost district by district, rather than just look at the national aggregate figures. And then you have to really set in motion the production capacity. As you rightly pointed out, we should have produced more doctors. Why didn't we? Because there has been a cartelization of the medical profession world over, including in the United States. That's why they keep importing doctors from abroad when they feel like it. Here also, the medical profession wanted to limit the number of doctors. It's also true that as private medical colleges came, it was important for them to keep the overall numbers of undergraduate and postgraduate seats less, because then they could actually charge more capitation fee per student. If you have easy admission to medical colleges across India, then why would they pay so much of capitation fee? So it's a business actually, which has actually derailed the process of producing the required number of doctors, and we need to change that process. And we need to actually start developing our district hospitals into medical colleges and nursing colleges linked institutions where doctors, undergraduates, as well as we can have nurses and allied health professionals, medical technicians trained. And even postgraduates can be trained through the National Board of Examinations, which can link up with the district hospitals. So we do need to expand all of these in terms of the production capacity. But we also need to correct the regional imbalances and make sure that there are enough number of doctors in some sort of a central cadre who can be deployed in different parts of India, rather than just let the graduates of southern India only work in southern India. So imposing bonds will not help if everybody is going to work only where there are many medical colleges, and if Bihar and Chhattisgarh and Jharkhand continue to be underserved.
So in a way, we need a more robust structure for the Indian medical services, like the Indian administrative services.
Yes, I mean, we do need people at the local level. There's no doubt about it. I would even say that in order to encourage local retention and service, 50% of the seats in each district hospital linked medical college could be reserved for the cluster of districts around that medical college. Government should subsidize that education, and then in return take 3 years of committed service after their graduation, and give some incentive for postgraduate education as well. Some such local service condition incentives must be created. But certainly, something like the IAS and others, there should be a central service where people serve in the states, central deputation for part of their career, go back, enrich both the state service as well as the central service with that experience. Otherwise, the central planners will remain oblivious to the conditions in the states, and their planning will get totally, out of sync with the ground reality.
That's such a fantastic suggestion, sir. Thank you so much for sharing that with us. So now I would like to know a little bit about your book that you have written, and please tell us about it, and what is it about, and what can the students learn from it?
Well, the book was actually inspired by the fact that we prepared a report for the Planning Commission of India in 2011. We were asked to prepare a document on universal health coverage for that framework to be integrated into the 12th five-year plan. Some principles of which were incorporated, and the Planning Commission did say that a pilot project should be carried out in one or two districts in each state, and ultimately, based on the lessons of that, there would be subsequent adoption at a universal level across the country. But they had also accepted partly our recommendation that we must jump up from 1% of GDP as public financing to 2.5% of GDP. But they went and said they'll do it by 1.87% immediately and during the 12th plan period, and they'll probably increase it further on later on. But unfortunately, because the Indian economy took a bit of a slump, and also because we had other priorities coming in, the government of the day who went in for Food Security Act, then ultimately health did not get the kind of funding it required, and our report got neglected in that sense in terms of implementation. But it caught the imagination of a large number of people in civil society and academia, and we felt that it needed to be brought out further again. But starting with that report, but not entirely depending on the report, updating the statistics, but also some of the concepts, and even some of the foundational concepts like I discussed with you, why it is important for financing of health, why is it important to look at equity dimension as well, not just looking at health service, and how health and development are intricately correlated, and dealing with issues like uh, health workforce, issues like drugs and equipment, and even drug policy. Why is it necessary to build public sector capacity and also self-sufficiency? And in a variety of topics related to health have been built into that book for healthcare planning, health workforce, for example, as well as the whole issue of governance and regulation. All of these have been touched upon in that book. It is meant for an intelligent lay audience. It is relatively jargon free, because I believe health is everybody's business, and therefore everybody must understand some of the principles on which a healthy society must be developed and maintained.
Great, sir. So everybody who is joining us, I would definitely recommend you to check this book out. It's called Make Health in India, Reaching a Billion Plus. And I guess, sir, it's available on Amazon and other platforms.
It is Amazon as well as Amazon India.
All right. It's on Amazon India. So please, everyone, check it out. Sir, let me ask the next question, which is related, sort of close to my heart, which is startups in India. And there are lots of startups which have recently come in the healthcare sector, starting from telemedicine. In fact, my own first startup was in the telemedicine sector, which failed miserably. But the point is that since then, sort of, we have done a lot of interesting, products and services for next billion users in India, as well as the urban Indians per se. There are lots of products which are research oriented, like stem cell and all other kinds of research oriented products are also being developed in India nowadays. But one thing that I've noticed is whenever it comes to research oriented, like deep tech research oriented startups, uh, the from innovation to manufacturing to market, that ratio is very, very low in India when it comes to specifically such sectors like healthcare. And so, in your opinion of being public health professional and being a practitioner for so long, what do you think the possibilities or opportunities that exist for startups in the healthcare sector in India?
Well, I'm quite aware that there are a large number of young people very much interested in healthcare startups, and we would very much welcome that interest and encourage them further on. Some startups do fail. That's the nature of startups. I would not say it's high infant mortality for startups. I would only say, like an infant, while learning to walk, stumbles and falls, but ultimately they get up and become stable on their feet and move around. So a few falls are okay, but I think it's important to continue. I think the lessons are critical. That firstly, identify what the need and potential applicability is. Quite often, a startup in health technology starts as a very bright idea, but without necessarily understanding how it actually meets the demand or the need in the field. Then it starts going looking for a need and trying to create the demand. So do have a good conversation with public health professionals, particularly who are in the health system management area, and talk to them about what the specific problems are and where this can actually fit in. So if there is a clear-cut identified need, or even if the need is not perceived by them immediately, but if there is a latent need that you perceive, talk to them about how that can be addressed. But that conversation is very important. Otherwise, you may have a very nice, interesting product, but it will lie on the shelf because the end user, the health system, is not going to pick it up. The second element, I believe, is do bring in multidisciplinarity into the whole area. It's absolutely critical. The more people you converse with across different disciplines, you'll get a better understanding. Because it's not only just the health system manager that is going to be important. It is also the people who are using it, the people in the ground. Culturally, how acceptable will it be? How easy it is for an ASHA to use it, or somebody in the state capital may not understand it. You have to talk to them as well. So it's very important to talk to multiple stakeholders at different levels and get a sense of what their reaction is. Then the important problem, of course, is where do you actually get your market? And that is where many startups fail. They may come up with interesting or even useful products, but they may not find a market. So I think that is where the government must actually come in, and even private entrepreneurs must come in with an advanced market commitment, saying that, okay, this is the need. You develop a product which meets this need with these kind of qualities and where the credentials can be tested. But if you do develop that and meet all those standards, we have a need and we commit to purchasing this amount and distributing it on our own through the health system and the programs for this amount. Otherwise, your initial investment will go to waste if there is no market that is readily available or committed. So getting both the ideas for innovation as well as advanced market commitments from the government and even private financiers is going to be a very important element.
Thank you so much for sir, for laying that out. And every entrepreneur who is out there who wants to start a startup in the healthcare segment, I definitely advise you to go and talk to professionals in the Public Health Foundation of India. They can tell you about the ground reality, and you understand the ecosystem much better, and then take better decisions in creating products that might be actually useful and actually have a market for it. So my next question is. What advice do you have for the young listeners or young Indians who are listening to this session and this conversation? What can they do for the healthcare sector of India?
Well, at the personal level, stay healthy and make sure that your family members and friends stay healthy. For example, don't smoke and don't allow others to smoke around you. And that's for a start. Watch your diet, watch your physical activity, and so on. But more importantly, recognize that you can actually advance health wherever you are. Everybody can be actually a public health professional. I used to say that every minister is a health minister, because the way you look at urban transport, urban development, food and agricultural systems, are they providing nutritious diets at affordable cost? Environment, whether it's air pollution or climate change or water, soil, chemical pollution, all of these, everywhere, whichever sector you are there, look at how you can advance public health in that sense. If you're in health technologies, look at where you can advance health technologies for better use, better access, better affordability. So I think it's important for every citizen to recognize that whatever be their specific vocational area, they can actually advance public health. And that is the multidisciplinarity of health. So you should play that kind of a role, both at the personal level for personal protection, but as a responsible citizen in a community promoting health, at the same time going ahead and ensuring that in your own field you do things that enable health but do not erode health. So that is important.
Great, sir. My last question to you is that to sum up, all the important things that you said, what would be your top three suggestions or priorities which can make India self-reliant in the healthcare sector?
Universal health coverage, which is led by a strong primary healthcare system. Second, also ensure that we have adequate, multi-layered, multi-skilled health workforce that can function at different levels of the healthcare system with efficiency, but also with empathy to deal with the people, so that we have a competent and compassionate healthcare system. Third, do provide consistently more healthcare financing, because without that, none of the other things are going to be possible.
Thank you so much, sir. Thank you once again for being with us and sharing all your insights and all the detailed conversation that you had with us. It's going to help all our listeners to understand the healthcare ecosystem in India better. And it's a privilege and a pleasure to have you here with us. Once again, really, really thank you for joining us for the e-Samvaad 2020, the online edition.
Thank you very much for giving this opportunity, this conversation, and this opportunity to interact even remotely with a bright young Indian audience makes me feel young and energetic again. Thank you. Much needed in this COVID-19 times.
Thank you, sir. Before I close, what would be your one-line message for everybody who is joining in for the session?
Well, I think we need to live in these rather challenging times with caution, but with confidence. And that is the way to move along till we get rid. But beyond that, we need to ensure that we build a healthy society which is healthy in all of its dimensions: physical, mental, emotional, spiritual, as the WHO says, but that depends upon all of us working collectively together, even if the ultimate end goal is individual health.
Thank you so much, sir. On that note, everybody who is joining in, deal with the current scenario and the future with confidence, but with caution. Thank you so much, sir, for joining us. It's great to have you here.
Thank you.